Welcome, everyone, and good morning to today's speaker series. Thank you all for attending. We have the privilege of hosting Anna Mayo, Manager of Tasmania's Voluntary Assisted Dying Commission. We thank Anna sincerely for her time, insights, and for joining us today. I would like to just take a moment to acknowledge the Palliative Pakana people as the original custodians of the Lutruwita, Tasmania. At Palliative Care Tasmania, we acknowledge the Palliative people's deep connection to family and community, and their enduring strength and compassion in caring for their sick, dying, and grieving. I would also like to pay my deepest respects to their elders past and present, and extend that respect to any Aboriginal or Torres Strait Islander that may be joining us today. Before I introduce Anna, I would just like to go through some basic housekeeping. So we will have 15 minutes at the end of today's session for a Q&A. So if you do have any questions throughout the presentations, just pop them in the Q&A box, which can be found at the bottom of your screen, and we'll answer them after the end of Anna's presentation. So without further ado, it is my pleasure to introduce Anna Mayo. Anna is the Manager of Tasmania's Voluntary Assisted Dying Commission with a background in health-focused law and regulation. Anna has been with the Department of Health since 2005 and has been in this role since 2022. Please join me in welcoming Anna Mayo.
Thank you. Thank you very much, Luke, and the Palliative Care Tas team. It's a pleasure to be here today talking a bit about voluntary assisted dying in Tasmania. I do have a presentation that I will attempt to share in a minute, but for those who are interested and don't know, I started with the voluntary assisted dying team in May 2022, so 2.5 years ago now. Initially working on the implementation, and then since the Act's commencement, I'm really focused on managing the Office of the Voluntary Assisted Dying Commission and assisting the Voluntary Assisted Dying Commission in their work. As Lucas said, please put any questions you have in the chat. At the end of the presentation, there'll be a slide with the contact details for our office and where you can get some more information about voluntary assisted dying generally. Please note that down. If you do have any questions that are specific to an individual or a particular scenario, perhaps shoot them through on their email or give us a call. Now, let me attempt to share my screen. Right. Hopefully, everyone can see a nice front page there of a presentation, Voluntary Assisted Dying in Tasmania. Oh. Luke, that was a really lovely acknowledgement of country. Thank you. In recognition of the deep history and culture of this island, I'd like to acknowledge and pay my respects to all Tasmanian Aboriginal people, the past and present custodians of the land upon which we're meeting today. So in the presentation, I'll just talk a bit about what voluntary assisted dying is, the eligibility and process for VAD that's set up under our legislation, what voluntary assisted dying is looking like in Tasmania at the moment, a bit about roles and responsibilities of medical practitioners, registered nurses and others. I'll talk briefly about the voluntary assisted dying training and the support that's available, and then we'll open up to some discussion. So, what is voluntary assisted dying? It's a process that allows a person who's suffering from a terminal disease, illness, injury or medical condition to legally access a substance to end their life with support and assistance from medical practitioners and registered nurses. The person can choose to take the substance themselves or have it administered to them with help from or in the presence of a doctor or registered nurse. So I mentioned before it's been available now for just over 2 years, but it's regulated by Tasmanian legislation. It is a strictly overseen and closely overseen and controlled process, and it can be accessed by Tasmanians in any setting. So all other states in Australia and the ACT now have voluntary assisted dying laws. Tasmania was the third after Victoria and Western Australia. And since then, everybody has had legislation go through their parliament. The ACT's legislation will commence soon. So it's just the Northern Territory at the moment that is a bit behind those other states. They have recently consulted on a framework for that in the Northern Territory. And of course, voluntary assisted dying has been available in other countries, including Canada, New Zealand, and several European countries for some time. So in Tasmania, our Act is administered by the Minister for Mental Health and Wellbeing through the Department of Health and has been in place now, as I said, for just over 2 years. So what are the eligibility criteria for voluntary assisted dying? They're set out there on the screen. You have to be an adult. You have to meet residency requirements, and these were inserted and are common to legislation around the country. Essentially, you have to be an Australian citizen, a permanent resident, or have been living in Australia for at least 3 years before you start the process. And you have to have been a Tasmanian resident for at least 12 months. In some jurisdictions, Western Australia in particular, there have been some legal rulings on what it means to have been a resident of the state in which you're living. And in Tasmania, the VAD Commission can provide advice to practitioners about whether a person does or doesn't meet the residency requirements. It's also one of the things that a person can seek a review of if they're unhappy with the decision that's been made by their primary medical practitioner or consulting medical practitioner. So a person does have to have decision-making capacity, and that's right from the beginning to the end of the process. That is assessed by the doctor or registered nurse assisting the individual at multiple points through the process. A person also has to be acting voluntarily and be suffering intolerably in relation to an advanced, incurable and irreversible condition that's expected to cause the person's death within 6 months, or if it's a neurodegenerative condition, within 12 months. And those assessments are undertaken again by the person's doctor that's involved. So under our legislation, there is capacity for a primary medical practitioner, consulting medical practitioner or administering health practitioner, and I'll talk more about what those terms mean in a bit. If they can't decide that, the person can refer the individual off to a specialist essentially, or somebody else to help with that decision-making process. And importantly, and this is unique to Tasmania's legislation, the Voluntary Assisted Dying Commission can issue an exemption from those 6 or 12-month life expectancy criteria. So I talked before about the process. It is deliberative, it is stepped, it's quite rigorous, I guess I'll say. You can see there, and really this is just to give an illustration of the process. It's really led by the individual, as the name of the legislation and the process suggests, and really tracked through in collaboration with a medical practitioner, and towards the end with a registered nurse in some cases. There are 3 separate requests: the first request, the second request, and the final request that are made to a doctor. At each stage, then, there's a separate eligibility determination. The substance authorisation is issued by the Voluntary Assisted Dying Commission after that final request has been made and determined. And then there's a final determination of decision-making capacity and voluntariness before the person gives their final permission to essentially proceed with taking the substance or having it administered to them. It does take time to complete each step in the process, and the average length of time overall from the first request to administration so far in Tasmania is about 30 days. It is possible to have a quicker process, so somebody who is considered by their doctor to be likely to lose decision-making capacity within 48 hours or to die within 7 days. The usual kind of periods between each of those stages can be waived, so to speak. It's a linear process. So if something happens partway through, say the person changes their mind and decides not to proceed, or if the person's primary medical practitioner needs to step away, sometimes there are limited options and the process needs to start again. That being said, there's no limit to the number of first requests a person can make. So what is a person's first request? It's really the first time when the person sits down and formally asks a medical practitioner to determine whether they're eligible to access voluntary assisted dying in Tasmania. Can be verbal or made in writing. We do have a first request form that's available on the Department of Health website that people can use. They don't have to use that form. Most often, the first request is a conversation essentially between the person and their doctor. There does have to be a face-to-face meeting between the doctor and the patient for that first request to be considered valid. And the doctor must naturally give the person information about their condition, their prognosis, their treatment options, and information about their palliative care and treatment options too. So I mentioned before there being some timeframes. These are legislative timeframes, and the Act does require there to be 48 hours or more between a person's first request and their second request, unless there are exceptional circumstances, and I mentioned those before. That is, if the person is expected to lose decision-making capacity within 48 hours or to die within 7 days. The second request does have to be in writing and it does have to be witnessed, and the Act's requirements around that are quite strict. The witness has to see the form being completed and signed, and the patient must be present throughout that process. Again, there has to be a meeting between the doctor and the patient after that first request has been made, and that is to allow the doctor to, be satisfied that the person has decision-making capacity in relation to their request. That particular meeting can be face-to-face or by way of audio-visual link. There'll be more to be said about that later on in this presentation. So after the first request and the second request, the doctor who has taken those requests, if they're satisfied that the person meets the eligibility criteria at each point, can refer the person off to a second doctor, an independent doctor, and that person is called the consulting medical practitioner. So that referral again requires a meeting between the second doctor and the patient. That can be face-to-face or by way of audio-visual link. And the second doctor's role is to provide their opinion about the person's eligibility back to the first doctor, so the person that took the first and the second request. If that second doctor doesn't think the person meets the eligibility criteria, there can be a second referral if the patient agrees to that. However, if two separate doctors decide on the referral that the patient doesn't meet the eligibility criteria, the process stops for them. There is capacity for a new first request to be made, but if it's being made back to the original doctor, the Commission needs to give approval for that. So after the second opinion, there's what's called the final request. Really, it's the third request, but in the Act, it's called the final request. And again, there has to be 48 hours between the person's second request and this final request, unless those exceptional circumstances apply. The final request also has to be in writing, but the witnessing requirements that I talked about earlier don't apply. It's made again to the first doctor, so the doctor the person made their first and their second request to. Again, there has to be a meeting between the first doctor and the patient, and it's really at that point that the doctor and the patient would be discussing the administration method that's appropriate for that person. It's at this point that the doctor must tell the person if they intend to be, if they intend to be the person who will supply or administer the VAD substance to the patient. And The person who does that is called the patient's administering health practitioner, or AHP. So after all that, and there is a fair bit of paperwork, it's a process to go through. The matter comes before the Voluntary Assisted Dying Commission, and their task is to decide whether to issue a VAD substance authorisation. And effectively that is an approval to the first doctor, the primary medical practitioner, to be able to issue a VAD substance prescription for the VAD substance for that individual. The VAD substance, if a prescription is issued, is then supplied to that initial doctor. And then we go on to the final permission or final determination stage. It's a little bit complicated, the process, and it does differ slightly depending on whether the primary medical practitioner decides to also take on those administering health practitioner functions. But effectively, you know, once those processes are gone through, the person can either be given the VAD substance for private self-administration, and that's where the administering health practitioner supplies the substance to the patient for the patient to then safeguard, store safely, and administer it at a time and place of their choosing. Or the AHP will keep hold of the substance and either administer it to the patient or supply it to the patient and be there with the patient while the patient administers it themselves. The third option there is that the AHP actually assists the person to administer the substance. So a bit of a snapshot here, I guess, of our data. It means a lot to us, but maybe not a huge amount out of context. But I guess that the key points, you know, to mention are the kind of median age of people accessing voluntary assisted dying at the moment is 74, and that's consistent, or reasonably consistent around the country. It's about just over 1% at this stage of people who die in Tasmania will die following administration of the VAD substance. And of those people who do access voluntary assisted dying, it's about 2/3 of people have a diagnosis of cancer. And around 75% have been in receipt of palliative care. So there's quite a significant crossover. I mentioned before that the time between the first request and VAD death is 32 days. And at this stage, we are experiencing, and people are making around 11 formal first requests per month. So roles and responsibilities. This is for all of the doctors and nurses and other health professionals listening. So a doctor basically can be involved by acting as a patient's primary medical practitioner, consulting medical practitioner, or administering health practitioner. Registered nurses can become involved by acting as a patient's administering health practitioner only. There are some quite strict requirements for a doctor to become involved by acting as the person's primary medical practitioner or consulting medical practitioner. They have to be registered. I think that's fairly clear. They do have to have 5 years practice after obtaining their fellowship or vocational registration as a GP. They have to have some relevant experience. They have to obviously be free of a conflict as concerns that particular individual patient they might be assisting. And they have to have completed the Tasmanian Voluntary Assisted Dying training in the previous 5 years. And I'll talk a bit more about the training on a next slide. So in most cases, the doctor who acts as the person's primary medical practitioner will become their administering health practitioner. But we are seeing increasingly registered nurses taking on that role. And if that occurs, if that's the primary medical practitioner's wish that they don't also take on the administering health practitioner role, the Voluntary Assisted Dying Commission becomes involved in appointing somebody who can do that. So the training, it's formal training. It's been approved by the Voluntary Assisted Dying Commission and was developed as a very collaborative process involving various stakeholders. It is available on USB to anyone who wants to complete it. So it's not just doctors or nurses who want to become involved. We've got quite a breadth of people, I guess, who've undertaken it really for their own knowledge. It takes varying amount of time. We would say about 5 to 6 hours. It's split up into modules. There are an education suite of modules and a short assessment module, which we've fairly recently separated out to make it easier for people to be able to work between the two different sets of materials. It's free. Not much in life now that is free, and it's available to everyone. So for any RACGP members, it does attract reviewing performance hours and educational activity hours. Other professional bodies, of course, will allocate those hours on application. So to date, we're really fortunate in Tasmania that we've got a very large number of people proportionally who've completed the training, and a high number, again, proportionally of doctors and nurses who have said that they're willing to take on those roles as primary medical practitioner, consulting medical practitioner and or administering health practitioner. So what support? We've talked about this process. It is linear, it is deliberative. It can be complex for people to navigate. The state does have a navigation service, and it's very rare to, I think, have a service which is received, in my knowledge, universal positive feedback about. They're fantastic. It's a group of 3 staff. They operate statewide. They'll travel to patients wherever the patient is, and really, provide that central point of contact and support. The VAD pharmacy service is, again, a statewide service. Their role is to supply the VAD substance, and they also educate patients and practitioners and others on the VAD substance and the administration options available. The Office of the VAD Commission, so that's where I'm from. We provide support to the navigation service and to the pharmacy service and, of course, to the Commission. And we're involved with education and training, strategic policy and community engagement. I've got a dot point there just on the clinician's handbook. That is something that we produced last financial year. It's available on the Department of Health's website for anybody to download and access if they want to really deep dive into the process. Not on this slide is mention of the THS clinical service. So the Tasmanian Health Service has a clinical service and a clinical lead for that service, and their role is to provide voluntary assisted dying services to Tasmanian Health Service patients. There are several doctors working for the THS, really, driving and delivering a fantastic level of support there. And individual private facilities may also have their own policies and procedures in place regarding voluntary assisted dying, and I think it's fair to say there are varying levels of support between facilities and across the state. So I'll briefly just touch on some minimum obligations that are set out in the legislation. The first is an obligation to respond to a person's clearly stated wish to access voluntary assisted dying. So if a person speaks to their doctor and clearly indicates a wish to access voluntary assisted dying, the practitioner has to provide the person with, at minimum, the VAD Commission's contact details. Now, we do have some kind of business style cards that we've printed up that we are very happy to distribute to whoever would like them as a really easy way for practitioners to provide the VAD Commission's details to patients. contact details will come up on a later slide, so please note them down if anybody in the audience would like copies of those cards. So if a person asks a practitioner to determine whether they're eligible to access voluntary assisted dying, the practitioner must go one step further and they must give the person a copy of a document called the relevant facts. That is an A4 size document that, again, we have had printed up. It's available in any quantity, well, within reason that a person wants on request. We're very happy to distribute those to anyone who wants them around the state. They briefly set out the voluntary assisted dying process in hopefully an easy to understand way and format for people who might be looking to access voluntary assisted dying and for those around them. We do have online copies as well. There's a e-copy in English. We have some translations available. We have an easy read version, and we also have an audio version for people who may find it easier to listen rather than read. So a medical practitioner who's asked by a person to determine whether they're eligible and who's given the person a copy of the relevant facts has to either accept the person's request or refuse to accept the person's request within a 48-hour period. They have to tell the person what their decision is, and they have to tell the Voluntary Assisted Dying Commission. So on our website, there is a form that doctors can complete to do that. It's really to allow the person, if their doctor can't or won't support them, and there can be a whole range of reasons for that. The doctor might not have the required experience, the post-fellowship. They might simply not have time in their calendar to support the person. They might not have completed the approved training, and they might not be able to do that in a time frame that's appropriate for that person's situation. But either way, the refusal or the acceptance at least allows the person to move on to Plan B if they need. So some other minimum obligations there, which I won't talk about too much, but essentially if a practitioner's asked to provide a person's medical records, they have to do that unless they have a reasonable excuse. And if the VAD Commission does issue a notice to a practitioner or a practice, that has to be complied with. So when Tasmania came on board with voluntary assisted dying, they followed Victoria, and Victorian legislation has what's called a gag clause, which essentially prevents medical practitioners from discussing voluntary assisted dying or initiating conversations about voluntary assisted dying with their patients. Tasmania does not have that gag clause. And a registered health practitioner can provide information about voluntary assisted dying to anyone who asks for it. A medical practitioner can initiate that conversation with their patient if they wish, provided they also inform the person about their care and treatment options, including their palliative care and treatment options and the likely outcomes. So it has to be a well-rounded, holistic conversation. Any other health practitioner, registered health practitioner, other than medical practitioners who we talked about before, who provide health services to people, can initiate a conversation with those people that is in substance about voluntary assisted dying, provided they make it clear to the person that they should discuss it with a medical practitioner. I'm sorry. I might just leave those contact details up on the screen just for a second if anyone wants to write them down. So on our website there, the Department of Health website, there's a specific voluntary assisted dying page. There's quite a lot of information on there, including some fact sheets, contact details, details of how to access the training, and details of how to access a quite short awareness raising module, for want of a better term, that we do have available via the website to anyone that wants to complete it. Any questions? If anyone wants any resources, anyone wants a visit from us or from the navigators or the pharmacy service just to generally talk to teams or to individuals, please reach out via email or that phone number. We are all Monday to Friday 9 to 5 services. But there's always capacity to leave a message on the voicemail, and of course we'll respond to emails as soon as we can. So I guess we're now at the discussion stage. Please, if I haven't covered anything, if anybody has any additional questions, please bring them forward, and I might just hand over to you, Luke.
Thank you, Anna, for that really informative presentation. I know the audience found it extremely valuable. We've got a few questions in here that we will get to. As Anna mentioned, we'll start the Q&A session now. So if anyone does have any questions, please chuck them in the Q&A function, which you can find down the bottom of your screen, and start asking them. I might be a bit selfish though, because I've got a few questions that I was kind of scribing down as we were going, just to start us off, and then I will get down to some of the questions that the audience have asked. One of them I had was just it's been implemented for 2 years now. I just want to understand from your perspective, some of the key challenges and maybe the key learnings that you've had over the last 2 years since it's been implemented.
Yeah, sure. Thanks, Luke. They're great questions. I might start with the second one first. So not everybody who starts the voluntary assisted dying process dies by taking or having administered to them the VAD substance. Now, there are a whole range of reasons for that. People change their mind, or they not infrequently, and this is anecdotal evidence, of course, or information that comes to us, being able to access voluntary assisted dying really gives people control back over their end of life and their death. And for some people, that's enough. So knowing that they have the option of accessing the substance if and when they choose, is enough for them. There are some people, though, who don't start the process early enough to be able to get through it before they die. So they might be partway through the request process, for example, before, and then they die of their disease. So I guess a key message would be, if people are considering voluntary assisted dying for themselves, or they have a patient who they think might be considering voluntary assisted dying, start the conversation early. There's nobody's locked in. A person can change their mind at any time, but having that conversation at least allows the person, to understand their options, what the process involves, and to commence it if that's what they choose to do. If a person's found ineligible, they might not meet the 6-month criteria, for example, they can wait and make another first request if they choose at any later point. In terms of challenges, there have been some challenges. I mentioned, being able to have appointments in person or via telehealth. That's not always as straightforward, that ability to have conversations via telehealth or over email or even sometimes by phone, because of a Commonwealth law called the Commonwealth Criminal Code, which does restrict the circumstances in which conversations about voluntary assisted dying can be had over those mechanisms rather than face to face. So there has been a lot of work being undertaken, between each of the jurisdictions, I believe, in the Commonwealth, and by bodies including Go Gentle and Dying with Dignity, etc., really raising that as an issue to the Commonwealth. It is a Commonwealth law, so of course it's up to them to decide what to do about changing it. But that certainly has been a challenge for everyone, including
Something that sits or that you notice is a challenge with remote or rural areas in Tasmania? Is that something that sort of frequently pops up for that sort of region? Like, does that have a greater impact?
Look, logic says that it would. We have a really dedicated group of practitioners and the navigation service and pharmacy service, etc., who will travel to meet patients, which is fantastic. We don't have the kind of tyranny of distance on a scale like Western Australia or Queensland, for example, or some parts of New South Wales even.
Yeah, I've met the navigators.
Yes.
Are incredible.
So I think it's less of an issue. And look, our I guess the regional distribution and just where we happen to have practitioners who are willing to assist means that people in the Northwest, for example, do have access to voluntary assisted dying, etc. But we do have pockets where, there aren't local practitioners available or who've completed the training to be able to support somebody at this point. So, yeah.
Yeah, brilliant. Well, that was my big question. Just sort of tied in my second question in that. So thank you for answering that, Anna. But I might go to the audience. So again, if you have questions, please pop them in. But I'll just pretty much start from the top to bottom here. But a question from Holly: is it possible to get pre-approved for this process for individuals who have a longer prognosis?
So any person can make a first request, but if they are outside of that 6 or 12-month time frame, their doctor has no option but to determine them ineligible at that point. I'm not sure if that answers the question or not. A person can apply to the voluntary assisted dying for a commission for an exemption from that life expectancy kind of time frame requirement.
Mm-hmm.
And that has happened. There's no barrier on starting the conversation early, so having an initial discussion with the navigation service or with your individual doctor or a doctor who might have been connected, you might have been connected with them to be able to have that conversation to kind of get things lined up. I think all the literature out there at the moment, around advanced care planning and so forth really does encourage having those early conversations with, health professionals and family and friends. It's probably more a matter of timing around that formal first request.
Thank you. Holly just responded, said that answers my question. Thank you. So, on point. Question from Mel: can the AHP be a friend and not a health professional?
No. Sorry, that's probably the short answer. So the only people who can assist an individual under our legislation to administer the substance are the medical practitioner or registered nurse who have taken on those administering health practitioner functions. It's not for me to say, obviously, but that they're the only circumstances that the law recognises, I guess, in terms of that assistance. And that includes even, helping the person to take a cup to their lips to take the substance, for example. Yeah.
Question from Paul: could you please provide a clear answer on VAD training, and is it available for all Tassie citizens, carer, family, and if they can be the administrator of the drug? I think you sort of answered that already. But I think the question out of that is, can any Tasmanian citizen do the VAD training?
Yep. Absolutely.
Yeah.
And we'd encourage anyone who wants to do it. It is targeted really at health practitioners, at doctors and nurses, but anyone can complete it. And we do have, a range of people who've done it for their own kind of interest. And there's no obligation on anyone after having completed the training to do anything. I mean, don't even have to tell us that you've completed it. There is also that short awareness module that I talked about before, that some people may prefer to complete. It's a shorter, it takes, I think, 15 to 20 minutes to do, and it just really provides an overview. That could be a starting point for somebody that's interested, wants to know a bit more, and then they might decide to do the approved training later.
And is there a cost associated with that? With the
No.
They're both free. I'll include a link in the follow-up email for all the attendees as well. So if you want to access that or have a look into it, then you can have a direct link into that. So I'll provide that after.
And I might add, Luke, if I can, that the navigation service has met and is happy to meet with groups of nursing staff or other staff in facilities, aged care facilities, private health facilities where that's permitted by the facility, community health centres, that type of thing, to just do a bit of a small group overview session, a bit like this, where people can have an opportunity to ask questions if they have them. So please do reach out to the email address and via the phone if that's something that anybody in the audience is interested in pursuing.
And I think obviously, Anna, you had that in your presentations, but again, we'll include that all up in the follow-up email. So some people have some contact details as well. Thank you. Question from Otter. Question from Rachel. Does the navigation service provide grief and bereavement support?
They do. And look, I'm not a member of the navigation service, so I don't want to speak for them, but yes, they do. They can refer across to specialist services, and I believe there is, and I don't have it to hand, but there is a specialist service I think it's based out of Victoria, available to Tasmanians that relate specifically to complex grief associated, or that can be associated with voluntary assisted dying. I can provide those details, Luke, if that's useful to you to distribute.
It sounds like the audience would really love that. So we'll connect after this and get that out to them. Is there a time frame of how long a patient choosing self-administration can have the substance in their possession before taking?
No, there isn't, but there is a rather curious set of provisions in the Act which say that if a person has to have possession of the substance for private self-administration, the doctor needs to issue that individual with what's called a private self-administration certificate. And those certificates last, so to speak, for 6 or 12 months, depending on the nature of the person's condition. So if after 6 months the person is still alive, they can still keep possession of the substance, but the doctor does need to then issue them with what's called an administering health practitioner certificate, and the person then really needs to have that AHP with them at the time that they administer the substance. So there's no restriction, but there is an additional requirement, I guess, if somebody does still have the substance after that period of time.
Sorry, that period of time, it was 7 months, did you say?
It would differ depending on the individual, but it's within 6 or 12 months of the private self-administration certificate being issued.
Yeah. Another question from Holly. Do you see that death doula services are being accessed by patients who are going through VAD?
I could only give an anecdotal answer to that, and that's that I would assume they are. I know that some death doulas are, very interested in voluntary assisted dying and have requested information about it. Beyond that, I couldn't say for sure one way or the other.
And this might be our last question, unless anyone has any other questions they want to pop into the chat. But question by Mary: once the patient has taken the substance, how long before they are no longer able to communicate, and how long before death occurs?
So on the first point, my understanding is very quickly. The person becomes unconscious, very, very quickly. And in terms of time to death, that does vary. I don't have the statistics here with me. And my understanding is it varies sometimes based on the person's condition and the administration method that they have chosen. Sorry, that's probably not a very specific response. So some jurisdictions do report on that in their annual reports. But I don't have those to hand.
No, that's fine. Sony, at the time of death, can the person have whomever they like with them, and can they choose where they die?
Certainly, the person can choose to have whoever they like with them. That's not something that's regulated by the legislation. So I guess it's probably more dependent on, if the person's in a care facility, what that care facility allows or doesn't allow. I'm sorry, I've forgotten the second part of the
No, all
question.
good. And the second part of that question was, can they choose where they will die?
Oh, again, yes, in theory, although obviously that's going to be dependent on the facility as well. Some facilities in Tasmania may not be as supportive of voluntary assisted dying as others. I'm talking private facilities. So we would always suggest that, the person is really clear with the facility about what that facility's acceptance is, I suppose, and how willing they are to support the person to die there if that's the person's wish. And we do sometimes get asked, and I'm not sure if this is where the question's heading, but what about dying in a public place? The Act doesn't regulate that at all, but I guess from a common sense perspective, if the person is privately self-administering and taking the substance and they're in a public place, there's a risk that their body, might be found by someone who perhaps isn't aware that they've died through voluntary assisted dying. It could initiate a, police or coronial involvement that, that the individual presumably might quite like to avoid, and another, private citizen could stumble across any remaining or unused substance. But yeah, look, it's not legislated. So yeah.
Another question from Holly. I think this is a follow-up. How can a service provider get on the list for the referrals for grief and bereavement services?
By contacting the navigation service, I would think, in the first instance. They are the service that does, I guess, provide that grief and bereavement referral and support. So the contact details that Luke will kindly circulate around, please just shoot through your query to that by email if you like, and we'll forward it on.
Absolutely. Another question here. I'm wondering what funding is able to be accessed for VAD. Is this something NDIS or insurance can cover?
So the Medicare benefit schedule does have item numbers that can be accessed. I think they're the counselling, and I think there's a general counselling item number relating to end of life care generally that can be accessed by medical practitioners who are providing VAD services in some cases. The Medicare benefit schedule does not cover the actual administration of the substance to a person, which is again something that there's quite intense lobbying out there in the public domain of the Commonwealth around that to broaden it out. I don't know about NDIS funding, all that kind of funding. Sorry, I probably can't answer that. If the person wants to send their query through to the email or give us a call, I can try and find out some more if that's about a specific personal situation.
Thank you, Anna. Another one here. What is your perspective, Anna, of palliative care in relation to VAD? Do you see VAD as another tool available for people who are nearing end of life?
So I think the data tells us that the people who are accessing voluntary assisted dying are also, in the majority of cases, accessing palliative care. And certainly under the Act, if someone does come through requesting access to voluntary assisted dying, there's a requirement for them to be effectively provided with information about their palliative care and support options. I'm not going to provide a personal view because I don't have one, but I do think, and I see the collaboration between Palliative Care Tasmania and other palliative care organisations and the Commission, for example, and a real genuine desire, for more information and for greater understanding between, palliative care and voluntary assisted dying about what voluntary assisted dying is and what it involves. I think early on there was certainly some talk or some discussion about voluntary assisted dying maybe being viewed as, being accessed by people for whom palliative care is not, sufficient, that they didn't feel that they would be getting enough from palliative care and therefore were accessing VAD. We haven't seen that, I can say, through the cases that, the Commission has seen.
Mhm.
I can speak for myself, I suppose. I think, this is a patient-driven process. Access to any health service is a patient-driven process. So it's always going to be for that individual to make their choice about what it is that they want to do for their own reasons. So sorry, that's probably not answering your question, but yeah, look, I know certainly. Palcare TAS, for example, have been fantastic in terms of, being really willing and engaged to work together on things like, expanding health literacy, for example, around end of life.
Did you have a percentage, I think, at the start of the presentation around those that have access, those who are
Look,
accessing that will also
it's a,
access palliative care? It was the 70-80%
it,
mark, I think, from what you said.
I've got my annual report here from the Commission. I can have a look, Luke, but yeah, it's
Yeah,
about
I
three
don't want,
quarters.
I don't want to flick through your document, but
No,
by the
no,
sound of it, it looks
that's consistent. That's consistent around the country.
yeah,
Yeah.
yeah, brilliant. A question from Mel. I often hear people living with dementia ask about access to voluntary assisted dying. This
Yeah.
is not possible at present, but there is advocacy for PLWD being able to access this in the future whilst they still have capacity to make that decision.
Yeah.
How far away do you see this option for PLWD?
I can't answer that really, because it would be a matter for Parliament to decide whether they were prepared to amend the legislation to change some of the provisions that at the moment would prevent most people with dementia from accessing voluntary assisted dying. So effectively under our legislation, you need to have a condition that will be expected to lead to your death within 6 or 12 months, and you need to have decision-making capacity at that final permission stage. And that really does preclude, in effect, a lot of people with a dementia diagnosis from being able to access voluntary assisted dying.
Yeah.
Some of the discussion that's occurring nationally and internationally is around whether one option could be to waive that kind of final permission component for somebody that's expressed a really clear wish throughout the process that that's what they want to do. And in fact, Canada, I can't remember which province, I'm sorry, but one of the provinces in Canada does have the ability for people to do that. The other point of discussion is around the 6 or 12 month, life expectancy requirement and whether removing that could provide an avenue then for people with dementia and other like conditions to be able to access. Our Act does have a mandatory 3-year review clause in it. So as soon as practicable after the 23rd of October 2025, so in just less than 12 months, there has to be an independent panel appointed or a panel appointed to conduct a review of the legislation over a 12-month period. I think it's fair to assume that topic, that discussion point will, be one that comes, is raised through the review.
Yeah.
And it would then be a matter for Parliament to decide, as with all law changes, what to do about that, if anything.
Yeah, thank you, Anna. And this might tie well into the next question, which is actually from my colleague Hannah. So, what is the comparison for TASVAD access compared to other states? So, I guess really, what are the other states' legislations in comparison to Tasmania? Maybe eligibility and sort of questions. Are they similar? Possibly.
They're reasonably uniform. So Queensland has, I think, just a flat 12-month criteria, so they don't have the 6-month life expectancy. They've just got a 12-month for all conditions.
Yeah.
The ACT is the jurisdiction that has departed, I guess, being the last jurisdiction they would say. They've been able to look at what other jurisdictions have done and build on that with their laws. And they do have some differences which escape my mind right now, but certainly that life expectancy criteria is one that that I believe they've done a bit differently. They also, I think, have slightly different residency criteria. So they talk about a person having a connection with the ACT rather than being necessarily a resident there.
Okay. Hannah also just said on the back of that as well that comparison of the rates of access as well as in regards to how many people have done
Oh,
it.
yeah.
Is it similar?
Yeah, look,
Population.
it's not completely dissimilar. So again, I don't have the stats in front of me. I think, and of course it increases over time and everywhere that has voluntary assisted dying in Australia, it's still quite new. So we don't really know what it will look like in, 10, 15 years' time. So Tasmania's rate is just over 1%, I believe. For since commencement till now. I think Queensland's rate in their latest annual report is up over 2. Western Australia's seen a progression, Victoria's seen a progression. So we're, I think, roughly in between Victoria and Western Australia.
Yeah, is that 1% of total deaths in Tasmania? Is that what you're referring to? Yeah.
Yeah.
Just to clarify. Yeah, okay. Yeah, so pretty similar across the board, across all states then.
Not totally dissimilar, no.
Yeah. Anonymous question here, which we might make this one the last one, just given us our time. You may have covered this before, but are there times when a person under 18 may be granted permission for VAD?
There's no ability in Tasmania for a person under the age of 18 to be able to access voluntary assisted dying. So there's no exemption or no is the short answer.
Yeah, brilliant. Well, I might just quickly share screen, but thank you, Anna, for taking the time to answer those questions. And thank you to the audience for asking them. I think everyone found this pretty valuable. Just before we all leave, I just want to thank all our members who are in attendance today. If you join today's event, the best way to continue to support Palliative Care Tasmania and the work that we do is to become a member, scan the QR code, or I will send you a link to join. It takes about 5 minutes. We have a bunch of different membership benefits and different categories that you can jump in and join. We've just recently launched our member hub, which has all the recordings from our speaker series in one place that you can view and watch, and this one will also be included in that. So take 5 minutes of your time today, join. I think as minimal as $20. So please take some time today to do that. Thank you again, Anna. We really appreciate your time. We also really appreciate feedback. So if anyone has 5 minutes of their time today to do a quick survey for us, it really helps us in our future events and future speaker series to continue to provide the information and the resources and speakers that you guys want. So again, you can scan the QR code here now, or I will send you a link after today's event where you can complete it. That one is a really quick survey. It won't take too much of your time, and it really helps us bring the speakers and information that you guys want. So I will send that out to you if you don't have time to scan it right there and then. Thanks again, Anna.
Thank you.
That 4 or 5 times now, but I think this is really valuable. We always get questions about VAD in the community, so I think this will be a really great presentation that we can steer people to jump on and get some really core information and learn more about what VAD is and how it's developing and where it's going. But it is some of the topics that we do discuss can sometimes raise complex, powerful and raw emotions. So I do encourage you all to keep checking in on yourself today. If you have any of those questions that you felt that you need more answers to or resources, I will provide my contact details, and I'm happy to pass any of those questions and queries on to Anna later today, and we'll get back to you as soon as possible. But I hope everyone has a really great Thursday. Go get some air, have another cup of coffee, and we'll see you in December for another speaker series very soon.